You're the ICU doctor on call, and ER calls you about a patient they just got Roscon. This patient is a 70-year-old gentleman who was found down in his nursing home by the nurses. They called EMS, they brought the patient to the ER. During the transport, he still had a pulse. It seems like he was likely hypotensive. However, upon arrival to the ED, he went into PEA arrest. Now, this lasted about 20 minutes. They did the usual ACLS algorithm. Notably, they did note that on his groin, there was significant bruising, which they suspected had some intra-abdominal bleeding. CT scans have been ordered, so now you're in the ED, you're assessing the patient, and at the same time, the family of the patient comes in. There's a wife and there's 2 daughters, and you're updating them about what happened. You're telling them that you suspect it was a fall, maybe an intra-abdominal bleed. You're not really sure. Currently, you're administering the patient with lots of blood products, IV fluids, and he's on 2 vasopressors to support the blood pressure. As you're updating the wife at the patient's bedside, you look over to the patient and you notice that one side of the chest is slowly rising and it's a bit more asymmetric than the other side. First of all, you just keep an eye on it, you continue the conversation. A few minutes later, you notice that it's now more pronounced on the right side. At the same time, you're also noticing that now the patient's blood pressure is starting to go down and there's some hypoxia as well. So you max out to the FiO2 to 100% and now you're increasing and adding a 3rd vasopressor. What's going on in this patient and how do you fix it?